Welcome, everyone. So my name is Brittany Shanahan, and I am the organizer for Public Citizens Medicare for All campaign. I'm thrilled to welcome you to tonight's Medicare for All Town Hall, co-led by Progressive Maryland. I know there's been some big news today, and it's okay to chat about it as you come in for now, because we're all just glad to be here tonight. I want to thank all of the organizations that co-sponsored the event tonight, and I'm going to share that. Here we are. So what we're doing with this town hall is trying to create a platform for a stronger movement for Medicare for All in Maryland, to forge relationships between groups that may not have even met before, and to really build together for the future. So I'm just going to read out this list of organizations very quickly, Tom Lehrer style. If you're with one of the organizations that I mentioned, please give us a shout out in the chat. All right, here we go. Public Citizen, Progressive Maryland, Chesapeake Physicians for Social Responsibility, Sunrise McDaniel, Healthcare Now of Maryland, PG Changemakers, Economic Action Maryland, and Medical Debt Maryland, SEIU 1199, Baltimore Nonviolence Center, SEIU 500, Harford County NAACP, Pax Christi Baltimore, Advance Maryland, Healthcare is a Human Right Maryland, Maryland Physicians for a National Health Program, Sandy Spring Friends, Unitarian Universalist Congregation of Columbia, AFSCME Council 3, Baltimore County Progressive Democrats Club, Progressive Harford County, Frederick County Progressives, Well-Paid Maid, Casa de Maryland, La Clínica del Pueblo, Coalition Against Prejudice, National Nurses United, Physicians for a National Health Program, Students for a National Health Program, Bread Baltimore, the Empowerment Team, and Maryland Acupuncture Society. Again, thanks for everyone who co-sponsored us tonight. We are honored to have with us tonight U.S. Representative Kweisi Mfume of Maryland's 7th Congressional District. Representative Mfume is a co-sponsor of H.R. 3421, the Medicare for All Act, as well as a member of the Medicare for All caucus in the House. We'll also hear from community leaders in the fight for healthcare justice who can offer a wide range of perspectives on how Maryland can benefit from Medicare for All. And we'll learn about how activists are building movement power from the ground up to make Medicare for All a keystone issue in progressive politics. In tonight's webinar format, unfortunately, only panelists can speak, but this is still an interactive event. So if you haven't already, please put your name, your pronouns, and where you're from in the chat, as well as any orgs you may be joining us from, and tell us what motivates you to join us, why you support Medicare for All. And please also, as our program goes through tonight, if questions come up in your mind about Medicare for All and about health equity in general, please put those questions in the chat. Some of the best experts in the state on this policy are in this virtual room right now, either as panelists or even in the audience. So we'll all do our best to answer questions about the topic of tonight. And if anything isn't addressed, I'll be sure to get in touch with you. We will also have an interactive portion at the end to help you think about some ways that you can be a part of this movement. And you may see a return appearance by the Delmarva Fox Squirrel at the top of your screen. So let me go over the agenda briefly. I'm going to kick things off with a quick introduction to the Medicare for All bills. Then we're going to hear from a handful of Marylanders offering different perspectives as to why this legislation is so urgent for our state. Then we're going to get a quick overview of ongoing campaigns in Maryland. After that, we'll hear from our keynote speaker, Representative Kweisi Mfume, a longtime advocate for national single payer. We'll finish things off with a discussion about how Marylanders can contribute and help build towards a long-term movement for single payer and health justice more broadly. Now, Maryland has this reputation as one of the better places to receive health care in the US. But when you scratch below the surface, a different picture emerges that is reflective of a national crisis. In Anne Arundel County, one of the richest counties in the state, in 2020, COVID-19 caused 19% of all deaths for Hispanic residents, compared to 5.9% of white residents. And at the start of the COVID pandemic, 18% of Hispanics and 6.9% of Asians in that county were uninsured. And this really demonstrates the lack of insurance does for so many in our communities. In Baltimore, 6.7% of residents under 65 are uninsured, and there is a 20-year gap in life expectancy according to your zip code. And surveys by Economic Action Maryland, one of tonight's co-sponsors, found that race and income disproportionately affect Marylanders facing medical debt. But Marylanders are resolved to work to transform our healthcare system, and we've seen some great progress in state legislation. Many of tonight's sponsors have worked hard in recent years to pass laws to address the very issues and the very statistics I just mentioned. And it would take several hours to do justice to those accomplishments that have happened just since 2020. Yes, and that's the way to see how to bring together state-based and federal level advocacy for healthcare justice, not to approach it as a competition, but as complementary portions of the calendar year. With the first 4 months, we have the Maryland legislative session, and then we have the rest of the year to look at our federal advocacy. It's just like when Orioles season turns into Ravens season. And that's why we're all here tonight, to build these connections and to grow our movement, to see a more cohesive identity in our movements towards both state and federal change. So I'm going to give just a very quick overview of what Medicare for All means, just so we're all on the same page. Medicare for All is a single payer program as opposed to a multi-payer system. It expands Medicare as it currently exists into a single public program with no fees, co-pays, or deductibles for visits or for prescription drugs. It improves Medicare to include vision, dental, long-term care, reproductive, and gender-affirming care, as well as hearing aids. And then it provides this health insurance to every person living in the United States as a basic human right. Healthcare will no longer be tied to your immigration status or your marital status. I'm going to put a link in the chat shortly from the Congressional Progressive Caucus, which goes into the components of the House bill in greater detail. But now let me introduce to you my co-host for tonight, Patty Snee. Patty joined the Progressive Maryland staff in 2020 and leads their organizing on state and national healthcare issue campaigns. Prior to that, she worked for 30 years with a number of national and state groups on economic and health justice issues, including the long-term fight for single payer. So take it away, Patty.
Thanks so much, Brittany. I'm really excited to have a group of 4 community members and leaders to kick us off for this portion. And what they'll be doing is sharing their perspective, their thoughts on why Medicare for All would benefit patients and workers, small businesses, and providers. So very excited to hear from them. So let me just tell you who these folks are up here in the box with me. We've got Gibran Eubanks, who works with 1199 SEIU 1199. We've got Dr. Krita Olson from Physicians for a National Health Plan, health program, sorry. And then Joshua Lamont, who's a Progressive Maryland member and has a personal healthcare story to share. And then we've got Eric Siedian, who is a small business owner. So excited to hear from you all. So Gibran, I'm gonna turn it over to you to kick things off.
Absolutely. Thank you, Patty. Thank you so much. And thank you all for having me. Again, my name is Gibran Eubanks. I'm the political organizer with 1199 SEIU. Here at 1199, we represent over 10,000 healthcare workers across Maryland and DC in hospitals, long-term care settings, and skilled nursing facilities. We fully support Medicare for All and commend Congressman Mfume, Public Citizen, and Progressive Maryland for all their advocacy toward getting this crucial legislation passed. We know it's imperative that we come together to take a stand against the privatization of healthcare insurance. Healthcare is a human right. At 1199, we understand firsthand what patients go through when health issues arise. Many times patients are prescribed medications that are not covered through the insurance, and they're encouraged to look into cheaper options. Other times patients don't have coverage at all and leave the hospital with insane medical bills that they can't afford, and leaves them in debt. So people are being forced to choose between going without care or facing $1,000 of $1,000 in medical debt. In Maryland, we have the longest ER wait times in the nation. But with Medicare for All, we understand that that would change. Instead of overcrowding in the emergency department due to patients visiting hospitals when they can see urgent care or their primary doctor if they had proper health coverage, we would see safer practices in these facilities. Workers would no longer feel overburdened due to taking care of an unsafe number of patients at one time. We could shift our focus to training and development, safe staffing, and livable wages for a workforce that is understaffed and underappreciated right now. And when we speak to our members, their number one concern is always the patients. They're concerned that due to short staffing, patients aren't receiving the high quality care that they need and that they deserve. So we must look at ways to achieve health equality, and the first step is Medicare for all. So we stand with Progressive Maryland, public citizen, and all Marylanders who understand the importance of Medicare for all, and we very much continue looking forward to working together to make sure that this is achieved. Thank you.
Thanks so much, Gibran. Really appreciate all those really important insights, and we stand with 1199 SEIU too. So next we have the opportunity to hear from Dr. Olson. So welcome up, Dr. Olson.
Hi, thanks, Patty. So my name is Elmkrita Olson. I'm a resident physician in Maryland, and I've been involved with organizing around Medicare for All for the past 8 years with Physicians for a National Health Program. I find that younger physicians are more supportive of Medicare for All single payer for multiple reasons. Medical school nowadays do focus on the disparities in health outcomes, health equity, and the social determinants of health, of which access to care is one. Secondly, younger physicians are increasingly coming from non-traditional backgrounds. They will have worked a job with adult responsibilities before school, so they have experience with having health insurance, co-pays, and paying bills. They also have more experience in social justice work, such as Black Lives Matters, the women's movement, the climate change advocacy, and definitely Bernie Sanders in his 2 presidential runs has exposed young people to the idea of Medicare for All and effective healthcare reform. And young physicians are coming around to the need for healthcare reform because of their day-to-day dealing with the increasingly frustrating and deteriorating healthcare system. And this includes the increasing administrative burden. So as residents, we are the ones doing most of the charting in the hospital when taking care of patients and doing all the phone calls to insurance to get coverage or prior auths. At a time when we should be focusing on medical training, we're mostly administrative slaves for the hospital, and it can be frustrating and result in burnout. Young physicians that are done with training also find it hard to have their own private practice and autonomy in their work life. Most physicians are employed by healthcare systems, private physician groups, or private equity groups, and are beholden to administrators that are also wasting their time with constant meetings discussing how they need to be bringing in more revenue by seeing more patients, doing more procedures, billing properly to get reimbursed. And all of this really adds to that administrative headache that takes up more and more time in a physician's day. Young physicians are also disproportionately feeling more moral injury from working in the system. As more patients are unable to access care adequately or are underinsured and facing high bills, physicians don't know if they're really helping patients when you're taking care of them, if what you're leaving them with is a high bill that'll leave them bankrupt and facing the social determinants of health that can worsen their condition. They also face distrust from their patients who regard their recommendations as just a way to make more money rather than medically sound recommendations. So all of this leads to moral injury and burnout among young physicians, forcing them to recognize a need for reform. Finally, another shift within younger physicians is the understanding that we're also laborers, beholden to a capital class, and we do not have the autonomy in the workplace like we once did. And this has called for more labor organizing. Among physicians, especially with residents, there is a fast-growing movement to unionize our workplaces across the country. I'm involved in such an effort in Maryland. And this not only helps physicians recognize their own power and voice, it's transforming what young physicians consider as part of their professional role. It's not just show up and take care of the patients, it's also about advocating for your patients and for healthcare reform so that patients and physicians can do better. This is quite a change for physicians. One of the big changes that happened with medical training is duty hour restrictions. And this was something that was handed down to physicians, not something that physicians fought for. And it was all because the patient's family sued a hospital over the errors that overworked residents had made. So now we have physicians that are really using their voice to demand better working conditions. And that's quite a change from before. So for all these reasons, younger physicians are politically different than their older counterparts and are more supportive of a Medicare for all single payer reform for a healthcare system. So for young physicians on this town hall, or really anyone who wants to advocate for Medicare for all, I would recommend joining Physicians for a National Health Program, PNHP, or any one of the organizations on this call, and we'll be sharing a QR code to do so during the town hall. Second, I would push everyone to think about organizing your workplace. Labor will play a big part in the fight for Medicare for all, and being able to convince your colleagues to use their collective voice and feel and see that they have power to create change will definitely help regular people push for a Medicare for all system against big insurance, big pharma, etc.
Thank you so much, Dr. Olson. Yeah, thank you. And for those calls to action and just all that perspective, just clearly, young doctors seem to be on the march, and that's wonderful. We need them. So appreciate your words here tonight and really all that you're doing. So thanks again. Now it's my pleasure to introduce somebody I just met a couple of months ago when we were out door knocking in Baltimore. So please welcome Joshua Lamont, who's going to share his story.
Thank you so much, Patty. I appreciate that. Again, my name is Joshua Lamont, and I had the pleasure of meeting Patty a few months ago as they were door knocking and told me about this big push for this initiative of Medicare for all. I could not possibly agree more. About a year and a half ago, maybe not quite that long, I had a bit of a health scare. I was at a barbecue with my wife, and I no longer had mobility in my right arm. Couldn't pick up a fork, couldn't load my plate. It was really quite a terrifying experience. My entire life, I've been a freelance interpreter, so healthcare has always been something that has never been given to me. I either had to pay for or just not have. So I'm very accustomed to saying, "Oh, I'll just sleep this off. This will be fine." And thank God for my wife. She said, "Nope, we're still going to the hospital." Now, luckily, at this point in my life and my career, I do have health insurance. I pay about $400 a month out of pocket just for myself. We arrive at the hospital and I get rushed in for stroke protocol, it's possible, or heart attack. I have 3 CTs, mainly due to blown veins from contrast. I'm then told by a doctor I have to be admitted overnight because they won't be able to get me an MRI to clear me until the next day. I kind of push back at this saying, "Hey, I don't really think I need to be admitted. I'm feeling much better now." It was really taken out of my hands in that moment. So I'm admitted for that night, MRI the next day, all of this just to find out that I have high blood pressure and it was a hot day, and sometimes that affects your body. All that would be fine, except for the bill I got roughly a month after the fact. Paying $400 a month in health insurance, all of that still landed me a $6,000 hospital bill from a hospital that charged me for each CT that they gave me, even though they messed up the contrast twice before. And this is a story that I'm sure a lot of us share. We've all gone and had these things happen to us and then walk away with a bill we don't know how to afford. And the reason I bring this up is about a month before I had my health scare. Conversely, my mother had hers. My mother genuinely had a series of 4 small mini strokes. She was sent to the hospital. They found the cause of the strokes. They found the clotted arteries. She was in the hospital for a month, probably a little bit longer than that. Multiple CTs a week, multiple MRIs a week, round-the-clock care, doctors coming in and talking to her. And when she walked out of the hospital, her bill was $0. And that's because my mother now is a Canadian citizen. We have seen how it works in a different country. We have seen how it works. I spent one night in a hospital getting tests that were not my fault, being admitted against my choice, and I owe $6,000. Now, I do see people in the chat, can I appeal? And most certainly there are ways to go about that. But the point is the hospital still sent me a bill for $6,000. Whereas conversely, we have a system in place all over the world that we can put here where people can get the care that they need. My mother did. And I'm glad to say she's fully recovered, still being checked up every 6 months from her neurologist, from her surgeon, all of these appointments, everything, and not a single dollar out of her pocket. If we can't do that here for all of our citizens, I don't know what we're doing when it comes to medical coverage or Medicare in general. So I appreciate you inviting me to share this story because I believe so many of us have that. And the point of all this is there is a way that it works, and Medicare for all is it. And so we just have to keep fighting.
Hear, hear. Amen. Thank you so much, Joshua, for sharing that. You just laid out and illustrated why we need single payer healthcare by doing that contrast. And glad that you're fine now and that your mother is fully recovered, thanks to a great system in Canada. So our final community member to speak tonight is Aaron Sayedian, who is also a Progressive Maryland member and small business owner. He's going to share his perspective. Thanks, Aaron.
Thanks, Patty. Thanks, everyone, for having me speak today. My name is Aaron Sayedian, and I am the owner of Well Paid Maids. It's a living wage cleaning company that operates in Maryland, Virginia, DC, and New York City. At my company, we start all our staff at $24 to $27 an hour, depending on their location. Give everybody a comprehensive benefits package, and that includes 24 paid days off per year, 100% employer paid commuting, and crucial for this conversation, health, dental, and vision insurance. And so I try to be a good employer. I offer my staff good health insurance and fair cost sharing. That means the company pays 80% of the plan premiums for not only employees, but also their spouses and dependents. And as a result, my health insurance spending is one of my highest indirect costs. Since founding the business in 2017, I've spent almost $200,000 on health insurance premiums. And for context, that's more than I've spent on advertising that entire time. And it's almost as much as I've spent on job supplies and equipment. So suffice to say, if I didn't have to pay directly for health insurance premiums as an employer, my business today would be bigger and my staff could earn more due to being able to invest that capital elsewhere. And, of course, what do my staff get for this enormous sum, which they pay an amount on top of as well? The same thing that, has already been described by others, right? The same runarounds, denials, prior authorization games, delays, high copays, out-of-network surprises, all these kind of things that we're familiar with. And, many of my employees have only ever used Medicaid in the past, and they're shocked to learn that their new private insurance, which they think is going to be better, is worse for them in every way than the Medicaid that they were on. And every year, we all know this, the cost goes up, right? The cost goes up far in excess of inflation, and the coverage also gets worse. So higher deductibles, higher copays, et cetera. And that sucks more investment out of my business, and it hurts my staff. And, the insurance industry wants us to believe that this is normal. This is the cost of doing business. Of course, it's going to go up by 15% every year, but, I know there's another way, and that's because I've experienced it with another form of insurance. So I want to tell you about that. When my company first started out, we used to offer short-term disability insurance to our staff to cover illnesses and injuries that happen outside of work, and also to offer maternity leave. And so I used to buy these short-term disability policies on the private market through AFLAC. And I did that until DC implemented its paid family and medical leave program, which is basically a public form of short-term disability insurance. And so by switching from private short-term disability to the public paid family and medical leave program, my policy costs fell by 2/3 and the coverage was better. So that meant more paid time off and better wage replacement while folks were out. And in fact, since that program debuted over the years, they have not only increased the benefits, they've increased the amount of time you can take away for paid leave, they've also decreased the cost to employers. The payroll tax on employers has gone down. And so that's the exact opposite of my experience with private health insurance. And so that's lower costs and better coverage with a public program. And that's what we're talking about. That's what we all want, right? We can do the same thing for health insurance. And when we finally do, in addition to erasing all this, needless tragedy and expense, like Josh talked about, that's inherent in our current system, we're also going to remove what I see as a huge drag on small businesses. And so, we should really go on the offense when it comes to Medicare for all and how it's going to impact businesses. We're going to get better coverage for our employees, and lower costs for our small businesses by moving to a public program, just as my business has seen with public family medical leave. So that's why I support Medicare for All. Thank you.
Thanks, Aaron. Couldn't agree with you more. We absolutely need to go on the offense if we're going to really move the ball forward on Medicare for All. So thank you. And thanks all of you. Thank you, Gibran. Thank you, Krita. Thank you, Joshua. And thanks again, Aaron. Appreciate it. So Brittany, do you want me just to move right to the, okay. So I want to take a few minutes. Thanks for the opportunity to do this. I want to take a few minutes to tell you all about our Care Over Cost campaign. This is our way of being on the offensive and fighting back against the giant health insurance industry that is only getting richer by the day, greedier by the moment, and as you all know. So that's our logo there, Care Over Costs. We're going to show a few slides. Brittany, thank you for your help with the slides. So Care Over Costs, which is part of the Progressive Maryland overall campaign for greater healthcare justice. So the problem, I think you all know the problem. Millions of Americans are harmed each and every year when private health insurers unjustifiably deny and delay their medical care, doctor-recommended medical care, and fight their claims. Just here in Maryland, again, Brittany said, we think we're that great, but we're really not. In between 2018 and 2023, such decisions by the insurance industry increased by 79%. 79%. That represents thousands of people. So this is, of course, happening in every state across the country. So our response, along with People's Action is our national affiliate of state and local organizations. We created the Care Over Costs campaign in late 2022. We had a kickoff webinar, national webinar featuring Senator Sanders and Representative Jayapal and others. And then here at Progressive Maryland, after last year's legislative session, we kicked our Care Over Costs campaign off in May and did a big community outreach drive so that we could educate the public and win public support for the campaign. So you can go to the next slide. So I want to just highlight the main demands and goals. There are really several of them, but these are the sort of top lines. So overall, we want to stop denials and delays of care and claim denials, just full stop. That's what we aim to do. So our focus is, one, getting lawmakers on the state and federal level to crack down on health insurance companies and these practices. Second, we're working to strengthen patients' rights and ability to appeal denials. Because actually what the Maryland reports show too is that when people do appeal and grieve the decisions, if they stick with it, they often, sometimes 50% of the time, win. The insurance company backs down. But as we all know, it's really difficult. It's time consuming. It's emotionally draining to fight the insurance companies. And third, we must make insurers disclose a lot more data and information. We need transparency, especially about the groups of people that are most often being denied. So we're working for that too. The overall arcing the arc, because our North Star vision is winning Medicare for all, we think this campaign will really help expose all the financial and other obstacles to getting care that we currently face in our for-profit private healthcare insurance system. It helps us dramatically make the case for moving from this system to Medicare for All. So now I just want to highlight some of our core actions and activities and strategies. So a few things. We've created a really effective, successful nationwide corporate pressure campaign. In just about a year and a half, we've had, along with our affiliates in People's Action around the country and many of our allies, some of whom are here on the call, 17 direct actions at insurance company headquarters, directly confronting them for their practices. And I think they've been held now in about 22 cities across the country. So taking our demands directly to them. In Maryland, our main direct action was last October. There's a picture of it here. We protested and delivered our demand letter to Care First at their Owings Mills headquarters. Can move the slides. Oops. I think there should be one more slide, Brittany.
I don't seem to have it, I'm afraid.
Oh, okay. All right. Well, I will recall what it is for sure. So the two other major focuses of the campaign are, one, identifying people with cases who have stories, but who are also actively fighting their insurance company for denying care or refusing to cover a claim. So by identifying folks and finding people who are willing to go public with their stories, we're publicizing their stories. It's a way of helping to name and shame the insurers and put pressure on them and put pressure on lawmakers. So that's a key component. And then, of course, because we are Progressive Maryland and we're People's Action, a huge part of what we're doing is the grassroots organizing and base building. So that involves door knocking, community outreach. So again, we can continue to educate the public and build support for this campaign and in the end for Medicare for All. We're also doing rallies and other kinds of virtual events. And we are working, of course, closely with our allies and coalition partners and working with lawmakers to identify more champions. So we've got a great summer planned of door knocking and other community events. So we hope that you'll join us for that. So thanks so much for listening in about care over cost. And I think it's now back over to you, Brittany.
Hello again. So I will incorporate that slide until the end, towards the end of our program tonight, so that folks can see everything. And it really has been fantastic work that Progressive Maryland has been leading in the Care Over Cost campaign this year. So now I'm just going to speak very briefly about resolutions, because we've got another speaker coming in. Which is just, we have passed 134 resolutions nationwide at the city council and county board level, 134 of them supporting Medicare for All, and 7 of those resolutions are in Maryland. And one of the council members who was a big part of passing one of these resolutions should be with us tonight. Councilmember Burnett, are you there?
I am, thank you. Can you all hear me? Perfect. Thank you all for allowing me the opportunity to say a few words. I just want to say a huge thanks to the coalition for helping us pass the resolution here in Baltimore City. Back in November of last year, we received unanimous support thanks to all of the hard work of the members of the coalition, meeting with council members, and really just speaking to why this is a huge issue for our constituents. one of for me, it was just important, knowing that there are so many residents, not only in my district, but across the city of Baltimore, who struggle with access to healthcare, and, overwhelming medical bills and medical debt and just everything that comes with not being able to receive care and receive care when you need it. We are actually in the midst of our budget hearings right now, and had a hearing earlier today about the impact of the overdose crisis and other sort of just access to care, and how that's really impacting our fire department's ability to respond, because so many people are reliant on just sort of just calling 911 to try and get into an emergency room, because they can't get that proactive access to care, to their primary care provider on a regular basis. And it just has so many reverberating impacts that you don't really think about on the day-to-day. And so for me, this was just an incredibly important issue to take up. And I'm just so thankful for you all for continuing this fight. I'm thankful for the opportunity to speak to you this evening, and just, say some encouraging words from here from Baltimore City, that, we're proud to be a part of so many cities who've taken this important step. And it's my hope that this is something that will come to fruition very soon for all of us, because it is desperately needed. So thank you all for the opportunity to say hello. I do have to go back to the budget hearings, but I didn't want to miss the opportunity to say a few words here, and just thank you all for your advocacy and for your support.
Thank you so much, Councilmember Burnett, for joining us and for showing how dedicated you are to the issue by skipping upstairs to share some words. So I'm just going to just go back to my screen real quick. And yeah, so the other resolutions that have been passed were Prince George's County. That's a big shout out to Sydney Jacobs, who is sadly no longer with us, who was a big part of that resolution. Montgomery County, Annapolis, Charles County. I still haven't met who did it in Charles County. I just found it one day. Frederick, and Anne Arundel County. And I mean, why you want to pass a resolution? Why is this such a good tactic? Well, local government is more accessible to people who are at the margins of the broken healthcare system. You can make a case, depending on whether or not your council is conservative, you can make a case for that it is going to save them a bunch of money, a lot of money in many cases. And also, we've just been able to build a great model that is focused on legislative advocacy and leadership development that really tests the limits of, what I said staff of 2 people. It's just a staff of 1 at this campaign now. And we have this comprehensive toolkit on our website that I'll share later, which has sample resolutions, meeting agendas, pretty much everything you need to get there. And then I'm also just around to answer any questions as well. But winning with resolutions, it just reminds us that Medicare for All is possible and it's achievable. And activists in districts belonging to Democrats in Congress who haven't signed on to the bills, they can bring resolutions with them to their lobby meetings. And finally, council members and commissioners do go on to run for state and federal office, like tonight's featured speaker, who was part of the Baltimore City Council. So let me stop sharing and then introduce our next speaker, Dr. Yewande Oladinde, who comes with an impressive resume in both community work and in many applications in the field of public health, because she was a big part of the successful effort to win a city council resolution in Frederick. Take it away.
Can you hear me? Hello.
Yes.
Okay, perfect. So hi, everyone. My name is Dr. Yewande Oladinde, and I am the president of the Association of Nigerians in Frederick, but I also I'm the chair of the Frederick County Immigrant Affairs Commission. And I was a part of the community activists that advocated for a resolution for the city of Frederick to endorse Medicare for all. And it took a series of efforts. So about a year ago, actually June 1, 2023, the city of Frederick was one of the municipalities that endorsed Medicare for All. It was a unanimous vote by the Board of Aldermen. The advocacy efforts really started, I would say, in July of 2021 or thereabout, when Annette Brylan, she's a member of the Frederick chapter of a group called Healthcare is a Human Right. And she sent out petitions and was collecting signatures from, anyone who believed in universal health care. And she collected, well, not just Annette alone, but Annette and the group collected more than 1,000 signatures on petitions from, folks like me, folks like others from other community organizations. And so I'm saying all of this to say that the way it really started was we started out by reaching out to some folks from our Board of Aldermen, and we just explained to them how it will be a huge cost savings, them signing on to this. And we really made the case. And by making that case, when this came out and went up for a vote, it was a unanimous vote. And so when I'm in the healthcare space myself, and when I think about how healthcare is being managed and run in the country, in the US, you realize that many people are going broke because they want to get healthcare, because they want to get good quality healthcare. And it's very unfortunate that even some of the healthcare they do receive isn't even of the best quality. And we believe that healthcare should not only be limited to those who have the resources. If you look at the spending, the United States spends the most on healthcare of all developed countries. And even with that, so we spend, just to put it into context, we spend over $4 trillion on healthcare. And you would expect that because we're spending that much on healthcare, that it means that every American should have the best health outcome. We all know that's not the case. And so I just want to say a very big thank you for all of the advocacy efforts. And I also want to say thank you because our mayor, Mayor Michael O'Connor in the city of Frederick, when the resolution was voted on by the aldermen, he also supported the resolution. So it takes a lot of effort to get this done, but in the end, it will all be worth it. And this is one more step to move us closer towards achieving health equity and also reducing health disparities for everyone in the United States. Thank you so much for inviting me, and thanks for the opportunity.
Wonderful. Thank you so much for sharing your story. I'm so glad you could join us. And just sort of sharing with all of us just the incredible community of activists that Frederick has. So now I want to turn it over to Karen Chi, who studies medicine at Johns Hopkins and who is a part of the brand new Maryland chapter of Students for a National Health Program, the student wing of Physicians for a National Health Program. Now, I've been at the sidelines with many other chapters around the country for the last couple of years. They passed medical debt relief legislation in Midwestern cities, won resolutions in Central Florida, and are also engaged in a struggle to reform the heart and soul of the American Medical Association. So it's great to see this action in Maryland. Welcome, Karen.
Thanks, Brittany, and good evening, everyone. I'm Karen, a medical student at Hopkins. I wanted to say that throughout my clinical experiences in medical school, I've seen patients struggle to access affordable healthcare. And without insurance, these patients aren't able to see a physician regularly, which means they can't address their physical or their mental health until they're hospitalized for something that could have been managed earlier. And seeing this on a regular basis and hearing everyone's stories today, these are the things that motivate me to advocate for single-payer healthcare. So I actually got my start in health advocacy through MedChi, which is Maryland's Physician Society and branch of the American Medical Association. While I was co-president of the medical student section of MedChi, I talked to physician advocates and legislators, and I was encouraged by their enthusiasm for medical students' contributions to organized medicine. They would always reinforce that we were knowledgeable and prepared to defend our ideas and that our voice mattered. Some of the things that I'm most proud of are first, collaborating with MedChi and the University of Maryland School of Medicine to lobby for legal protection of gender-affirming care and insurance coverage of behavioral and mental health visits. And in January this year, we brought around 40 medical students to Annapolis, the state capital, to talk to state legislators about these bills. And it was really cool to see my peers getting excited to talk about and research these bills, and also to see their surprise at how collaborative and receptive people can be in politics despite any preconceived notions they might have had. And secondly, with Evelyn and Jack, Evelyn is actually on this call. There are two other Hopkins medical students. We wrote a resolution about single-payer healthcare and introduced it to MedChi with the help of SNAP, which is Students for a National Health Program. And even though this resolution didn't get accepted, it was not rejected outright. And we had really good conversations with physicians about where to go from here. And we were mutually receptive to each other's ideas. And so this is really encouraging for me. And this collaboration is what got me connected to SNAP and Physicians for a National Health Program. And so I'm hopeful and excited to continue my advocacy here. But that being said, one of the most exciting parts of health advocacy is, of course, getting to know the policymakers, hearing their perspective, and working together to make an impact. So it's an honor for me to introduce our next speaker. Joining us now is Congressman Kweisi Mfume, representing Maryland's 7th Congressional.
Right. He's still logging in. I don't think he's in quite yet. But yeah, so we'll read it out in a second. Thank you so much, Karen, for talking about all the amazing work you're doing. We'll probably come back to you to introduce the congressman in just a moment. So I'm going to share the slide that I missed, so that just to remind folks of the opportunities coming up with Progressive Maryland. And please shout out in the chat when the congressman joins us. Just a reminder that these are the things that are coming up with Progressive Maryland. Is you have opportunities for door knocking, grassroots campaigning, and sharing and publicizing stories. And some quick resolution tips. Set up a phone call with me. Understand also that your biggest challenge is securing your champion in the council, and not really the council vote itself. You also want to look for a council champion who has a record of collaboration with the rest of the council. Moderates are often just as enthusiastic about this as progressives. And with the moderates, you can approach them with some statistics about how much the city could save on its spending on healthcare for municipal employees. It's a lot of money. And that's another reason to set up a meeting with me, and I'll help you figure out how much that is. So, and then, just another tip, if you get ghosted, circle back in 2 weeks. Council staff, they're busy and sometimes underpaid. So just try again. You can also, like we heard in Frederick, you can use petitions to gain endorsements from local advocacy groups and activists. These allies can help you secure a meeting with a council member that may have been a little difficult to pin down. And finally, you want to use our toolkit at medicareforallresolutions.org, which I'm putting in the chat. Oh, thank you, Mike. I will stop there. Let's see. Okay. I think we may just continue with our program. Okay. Let's just continue with our program. So I'm going to share. What? Oh, here we are. Okay, Karen, go ahead.
Okay. Also now I would like to introduce Congressman Kweisi Mfume, representing Maryland's 7th Congressional District in the U.S. House of Representatives. He first became involved in health policy as chairman of the Health Committee during his time on the Baltimore City Council from 1979 to 86. During his first tenure in Congress, from 87 to 97, Congressman Mfume helped establish the Congressional Task Force on Sarcoidosis Disease Awareness, an inflammatory disease that disproportionately affects African Americans. Then, as president of the National Association for the Advancement of Colored People, the NAACP, he established the organization's Office of Health Advocacy to fight for access and affordability in healthcare. Congressman Mfume also served as the executive director of the National Medical Association, which represents African American physicians. And just a year after he joined the National Medical Association, then Health and Human Services Secretary Kathleen Sebelius appointed him to the National Advisory Council on Minority Health and Health Disparities at the NIH. Congressman Mfume also functioned as a member of the Board for Research America, an advocacy group to encourage Congress to support research funding on behalf of the NIH and the Centers for Disease Control and Prevention. And now back in the US Congress, Congressman Mfume is committed to working tirelessly to ensure that the American people have an accessible, affordable, and quality health coverage. I would now like to formally welcome him and open the floor for him to share a few words with all of us this evening.
Representative Mfume, are you there?
I think you're still muted.
Oh. Just unmute. We got it.
Yeah, we got it. Okay. And I was just running my mouth saying, does anybody hear me? So you do have confirmation on my audio, correct? Here we go again.
Yes.
Okay, good. Well, first of all, thanks for having me. And I want to thank you for those very kind and gracious introductory remarks. You know, I've tried to do a lot in my life, and I don't take a lot of credit for things that are service oriented, but it does feel good hearing you sort of recite the fact that I've been a little busy over these years doing a number of things that are health related, which means so much to me. I want to thank everybody that's on board. I don't know if Councilman Burnett is still on board, but if he is, Chris, how are you? And to everyone else, thank you for logging in and listening. I apologize. There are two other things going on, as there usually is. And so I'm here with you nonetheless. And if you'd like to roll this over and make up the time lost on the back end, that's certainly fine with me. I have always believed that health is a civil rights issue, and that we have an obligation to prioritize tackling health disparities, particularly those of us who are policy makers. Just this past March, I echoed this belief with the Maryland Secretary of Health, Dr. Laura Herrera, when she met with members of Maryland's congressional delegation on Capitol Hill. And it's something that I say every opportunity that I get. It is a civil rights issue. Despite the many gains in healthcare coverage across most racial and ethnic groups that took place, particularly in the years 2019, 2020, 21, and 22, disparities across those racial groups still persist. Non-elderly American Indian and Alaskan Native and Hispanic people had the highest uninsured rates at 19 and 18% respectively. That's just sort of unheard of. Uninsured rates for non-elderly Native Hawaiian and other Pacific Islander groups and Black people were also higher than their white counterparts, something that we should not tolerate for the sake of all of us, no matter what our race or ethnicity is, so that we're able to make sure that the quality of life that people have and that they look forward to is something that they should be rewarded with. One would think that after confronting unprecedented global pandemics, particularly the last one and the one 100 years before that, that claimed the lives of 6 million, this one claimed the lives of 100 million, or 1 million, excuse me, you would think that healthcare, after all these many years, and in this case, centuries, would be a priority issue in the Congress. That's just not the case. The Republican majority have framed the Congress's legislative agenda around three things. Number one, Hunter Biden and creating a revolving door of U.S. House speakers and bowing down to the bidding of an indicted and now convicted former president who has spent more time on the courtroom than he has in other areas and in other arenas. Democrats have time and time again tried to embody our principle of putting people over politics. It's very, very important to us. In line with that, House Democrats and our mission of serving all Americans created, as you know now, the Medicare for All Act of 2023. That was sponsored initially by Congresswoman Jayapal and Debbie Dingell, along with on the Senate side, Bernie Sanders. This legislation on the House side is also co-sponsored by more than half of the Democratic caucus and 13 ranking members. The Medicaid for All Act builds upon and it expands Medicare to provide comprehensive benefits to every person in the United States. That includes primary care, vision, dental, prescription drugs, mental health, substance abuse, long-term services, and reproductive health care. The Medicaid for All Act of 2023 also includes, as you know, universal coverage of long-term health care with no cost sharing for older Americans and individuals with priority, and it prioritizes home and community-based care over institutional care. Additionally, patients have the freedom to choose the doctors, the hospitals, and the other providers they wish to see without worrying about whether it's part of a certain network. And more importantly, the legislation streamlines the healthcare system to negotiate drug prices and to reduce the exorbitant costs of administrative waste. And so for a nation, our nation, that prides itself on being innovative and a leader on the global stage, the United States, unfortunately, unquestionably fails flat when it comes to our current healthcare system. We spend more on healthcare-related costs than any other high-income country, and yet we still have the lowest life expectancy at birth and the highest rate of people with multiple chronic illnesses and comorbidities. Compared with the peer nations that we're often compared with, the U.S. has, as you know, highest rates of death from avoidable and treatable causes and the highest maternal and infant death rates around. So we are a clear outlier in terms of these disheartening metrics. We're also an exception in one other factor that could steer policymakers in the direction of how to right the ship. The United States is one of the few developed countries that does not have universal health care. I always sometimes have to just pinch myself when I say that because it's so unbelievable when you consider the number of years that we've been trying to find a way to make sure that our citizens are taken care of and to emulate, if we can, to some extent on this issue, what's happening in the United Kingdom, France, Spain, Canada, Germany, and so many, many other nations. As a result of our nation's misapprehension, I think, when it comes to misunderstanding universal coverage, an estimated estimated 25 million non-elderly people are uninsured. They're neglected, they're left to fend for themselves and to cover exorbitant medical costs. And as of this figure, working and low-income families and people of color are the ones that are affected the most and represented the most. Here in Maryland, as some of you know, 6% of our state's population are uninsured. These are our friends, they're our neighbors, they're family members who have nowhere to turn when simply asking to receive the medical treatment that they need to live. And that is not an understatement. Many of them need this medication and the treatment and the access to care in order to live. And so many Americans feel as though our current system is almost mocking them. And watching someone like the guy who created the drug Daraprim 6 years ago increase the cost from $17 a pill to $750 a pill just shows how Big Pharma, and in this case, Little Pharma, thumbs their noses at all of us. So studies have shown and will continue to show that Americans, by and large, believe overwhelmingly that the federal government should insure Americans and they should have health care coverage. My colleagues across the aisle always talk about how are you going to do this? You do it by getting the wealthiest of us, the corporations, big pharma, and others, to pay a part of that cost. And they can do it and they should do it, but they've got great lobbying arms that keep us from doing it. So I got started long ago as an activist on healthcare issues, going always back to my days at the university. Got involved with other issues, whether they were the freedom of South Africa or the corrupt apartheid government or small business issues or just basic health issues where people who did not have access were not allowed access. And I want to encourage those of you who are still matriculating to see this as something that you get behind and stay behind for a long, long time. Life is finite. We all know that. Very, very finite. And to the extent in our own lives that we can make a difference in the lives of others, particularly when we know better, when we're equipped with the facts, when we have the energy and when we have the passion, we should do that. And that is why the efforts here in the state of Maryland and the efforts of all of you mean so very, very much. If we were to tie in right now into the state of New Mexico or Illinois, Florida, you would find there's so many other people who have the same belief and passion that you do, who want to find a way to make a difference, who don't know that necessarily we are here in Maryland or that there are others even in their own state that feel the same way. And that's why it is so very important to continue to talk this issue up, to continue to work with like-minded individuals, to challenge the political system and those of us who have the honor of representing you, and to make sure that to the extent that we can take advantage of the larger media in this country to keep raising these questions over and over and over again. I am absolutely convinced that we will get Medicare for all, but it's not going to happen unless all of us are pushing day in and day out to make that happen. So it, for me, is a privilege and an honor to be able to kind of ramble for a minute and give you some of my thoughts about what this looks like, what the fight is going to be in Congress, and it's going to be a big fight. And to also sort of look down the road, if in fact the House majority changes hands, with some sense of hope that it will get through the House and hopefully get through the Senate. But that's a long way off and a lot of fighting between now and then. So stay true to who you are and to your beliefs about this. And let's all see each other not only just as our brothers and sisters, but particularly our brothers, our sisters, and our families on the issue of Medicare for all. It is so very, very important. I don't know if the format here is to go to questions now, but I'm going to yield back and be directed by whoever tells me what to do next. Thank you.
Thank you so, so much, Congressman Mfume, for your words and for joining us. So we're actually going to go to our interactive portion next, but if you were able to answer any questions that come in the chat, that would be for a couple minutes. That would be fantastic. If folks have questions about the legislation or just your long history as an advocate for this issue. So now I'm going to, and thank you just again, I'm so excited that, I've been running these webinars for 5 years around the country. It's so great to see my city, my district have such strong leadership on this issue. So thank you so much for joining us.
Thank you very, very much. And I'm assuming that there's some other residents of the 7th District somewhere in this group, correct? Ah, there we are. Okay, good. Good to see all of you.
And so here we are with the interactive portion, and I love our environment. So I'm going to introduce some Maryland species and ask our audience to choose which animal they identify with as an activist, and then to let us know in the chat. And that way we're going to get in touch and find a place. We're going to match make you with the activities that correspond to this animal. So first up is the blue crab. So if you're a blue crab, you're boiling inside about the cost of healthcare. You're running sideways about a medical claim that got denied by a greedy insurance company, or maybe Patty's presentation about the care over cost campaign just made your eyes pop out. Even if it's just signing a petition to joining a mailing list, you want to get involved in this work to hold insurance companies accountable. So if you're a blue crab, tell us in the chat that you're a blue crab. The next one is the great blue heron. Great blue herons respond to threats by making noise so that everyone else can hear them. If you're a great blue heron, you have a healthcare story about an injustice that you or a loved one has faced, similar to some of the stories we heard here tonight. A great blue heron will be willing to write out their story with their campaigns, or maybe you're intrigued by the opportunity to perfect your advocacy squawk by joining a storyteller's training session. So if you are a great blue heron, if this sounds like you, please let us know in the chat. The Diamondback Terrapin. If you're a Diamondback Terrapin, you're social. You're involved in at least one organization already that has members who would be interested in Medicare for All. You can work with us to make a presentation to your union chapter, your congregation, or your organization about Medicare for All, or you have this big network of great activists you can reach to from other organizations to bring into new coalitions to help us win new representatives and senators as bill co-sponsors. If you are a Delmarva Fox squirrel, if the Diamondback Terrapin is you, please let us know. If you are a Delmarva Fox squirrel, the Delmarva-licious, body positive Delmarva Fox squirrel, you have a solid idea of the advocacy ecosystem, or maybe you're just a quick learner. You're interested in working on the city council or a county board resolution in or near where you live. You like to take the lead on projects. And if your council is a tough nut to crack, you'll figure out a way to get through to them. So if you are a Delmarva Fox squirrel, let us know in the chat. I'll share that later. So again, choose your fighter. Are you a blue crab? Are you motivated to grab on to the care over cost campaign against greedy insurers? Are you a blue heron who wants to be heard, to share your healthcare story, or attend a training on how to use that story to win over elected officials? Are you a Diamondback Terrapin, willing to stick your neck out of the water and present or bring a guest speaker to your organization, or willing to recruit new organizations to this movement? Or are you our favorite ground squirrel, the Delmarva Fox squirrel, an independent problem-solving creature who is ready to work on a resolution for Medicare for All in your town or county? So let us know which one of these creatures is corresponds to how you want to interact with us. Great, awesome. So we are running out of time. Thanks so much to everybody who has joined us thus far. I'm gonna put, I missed the PNHP graphic, so we're just gonna put the link in the chat. And so thank you so much to Representative Mfume, to all of our fantastic speakers for joining us. And I want to hand it back over to my fantastic co-host, Patty, to close us out for tonight.
Okay, great. Well, this has been, whoops. Can you all hear me? Sorry. Just got a weird, your network is unstable. So I'm going to take 1 minute to wrap up. Thank you to you, Brittany, for really being the lead organizer on this and presenting such great information. I want to be all of the creatures that you just named. So thanks everyone for being here. We will send tomorrow an email. We'll send links resources, a recording. We do have the recording of tonight's town hall and some other information. And feel free to contact us with any questions or requests that you have. So the other thing I just want to lift up that's on everyone's minds, I know, and listening to Representative Mfume, such a champion, we all know that we need more champions for Medicare for All in Congress, especially in the House, but definitely in the Senate too. So in Maryland in 2024, as you all know, we're going to elect a new senator and we're going to send 3 new House members to Congress. So this is a good year, a really, really important year for us to lift up healthcare equity issues and justice issues and Medicare for all. So you'll be hearing more from us at Progressive Maryland about that in the next few weeks, but encourage everyone to get out to candidate forums, ask candidates to support Medicare for all, get information about their positions, whether it's the race for Senate or the district races in District 2, 3, or 6. Let's put healthcare and Medicare for all on the ballot this year. So thanks again, everyone, and enjoy the rest of your week.